I wanted to talk today about getting a blepharoplasty. So that is surgery that you have done on your eyelids. It can be upper eyelids or lower eyelids. I had my upper eyelids done about 2 years ago, and I wanted to talk with you about the procedure. And I have some before and after pictures about getting consultation and what the results were like. So, like I said, it's been approximately 2 years now, and overall it was easy. It was easy for me. It's going to be different for everybody, and the best thing to do is talk with your doctor about it. Get a consultation, or if you don't have to have a consult or a referral to a plastic surgeon, then seek out a plastic surgeon or 2 or 3 and have a consultation with them. So I had 2 consultations in the area where I live, which is Seattle area. And then I got on YouTube and started to research a lot of different plastic surgeons and saw that the one that really seemed to stand out to me and seemed to have a lot of expertise in making it look natural was somebody that was down in California at UCLA. And that is Dr. Jason Roostaeian. So he was fantastic. I went down, got a consultation. I want to be totally upfront with the money too. It was $300 to have the consultation. If you decided to have surgery done or a procedure done of some sort, that money can be used towards your procedure. And he just asked me, you know, what do you want done? What don't you like about your eyelids? Why do you want them done? He explained to me what the procedure would be like, that it wouldn't be an outpatient clinic, that would be inside the UCLA surgery center in the OR. So a lot of places like to do them in a clinic, in a plastic surgery clinic. Even I've heard about people getting this done in a dermatology clinic. I wasn't really comfortable with that. I like the idea of being at UCLA for one. It's a fantastic place, but also that I was there getting this minor surgical procedure done among other people getting bigger surgeries done for lots of different things. So after he explained that, I scheduled it. I think I scheduled it out probably 2 months later. And I'm going to show you some before and after pictures. I'm going to show you what I looked like afterwards. I would say day 4 was probably the worst because there was more pain on day 4 because there was more swelling. And I had one eye that was a little bit worse than the other 4 healing, which isn't unusual. No bleeding, no intense pain, nothing like that. In fact, it's kind of crazy, but when I got into the recovery room, it felt like a spa to me, probably because I work all the time. And this is like, you mean my recovery room nurse was asking me if I wanted coffee and got me some? He was really amazing. So I just appreciated all the care. So after the consultation, and after booking the appointment, I checked in, got there at my time of surgery, checked in, just like any surgical procedure you're going to have in a hospital, not in a clinic, and got my IV started. The only problem we had was I had just gotten the tops of these pierced, and the tops of my ears pierced, and we could not get those earrings out. They brought out pliers. We tried everything and could not get them out. So anyway, that was the only little hiccup at all. So he taped them really good and got into the OR, had propofol and other things, did not go under complete general anesthesia sedation. Was comfortable. I was comfortable the whole time. I did wake up, but I always wake up when propofol is used. I don't know why I metabolize it that way, but I do. And I opened my eyes. I could see everything that was going on, and then I closed my eyes, and that was that. Nothing scary, nothing uncomfortable. Everybody's there to take care of me. Safety's first, pain management, I was fine. So got to recovery room. I did fine in the recovery room. Like I said, was treated like a VIP. It was just amazing to me, the care. And my post-recovery nurse only had me, And he just took really good care of me. When it was time to go, left, drove to the hotel, because I'm not from California, although I'm there an awful lot, many times out of the year. So got back to Pasadena, got into my hotel, did everything that the post-op instructions said to do. Ice, rest, and you'll see in one of the pictures I brought one of those neck things like that you can use on the airplane, or a really soft pillow would work, and you're gonna, at least my instructions were to have the head of the bed elevated, put pillows up, fold towels, whatever you need to do, but that helped me a lot. And pain pills I had that night, pain pills were the next day, and then you'll see lots of pictures of me out and about because I felt really good. Day 4, yeah, that's when the swelling hit, and I did call the clinic. She reassured me that this was all normal. I didn't get to speak with Dr. Roostaeian. I would have liked to. Kind of like when I had my hip replacement, when I have a concern or a problem, I really wanted to speak with the doctor. I want to speak to the person who has done the procedure. So she reassured me everything was okay, and that my swelling and slight eye deviation and some other symptoms I was having were normal. That went away. You'll see a picture of me where it looks like I'm wearing burgundy eyeshadow. I've never worn burgundy eyeshadow, but you know, now I know what I look like in it. That's just the bruising. My bruising did not, like some people, go down here, or you see that often, I guess, with more nose surgeries and different things. I didn't have bruising down or up or off to the sides. It was just strictly in this area. He did run a suture through here, the center, and over. So you're going to see, that's what this is going to be in the pictures, that little white sticky dressing, and the sutures come across. So you'll see at the end too, when my sutures came out, he then cut and took that and did one pull, and all the sutures came out with one pull. Overall, the experience was fine, was fantastic. I'm so glad I got it done, and I wanted something that was really natural. The eye surgeon that I know and really like and trust and have been friends with for a long time, when I looked at his pictures, they were all pretty extreme in my opinion. They seemed more fat was cut out, very hollowed out. I didn't want anything like that. I just wanted something that was completely natural. I'm very happy with it. I absolutely love Dr. Roostaeian. I would like to one day go get all this done, but you know, that's a really big procedure. I don't know that I'll ever have that done, but I'm happy I got this done. I think the recovery was very easy. Make sure that you get a consultation and talk about the risks and benefits with your provider. Everybody is different. I just wanted to give my experience. When I researched it on YouTube, I saw some people who, you know, just it was horrible for them, or it was a negative experience. I've had a lot of different things that were really impactful in a negative way for me as far as medical treatments or procedures, and this I would not say was one of them. I would say this was great. And do your own research. Just research different plastic surgery clinics. Make sure it's a board certified plastic surgeon. Just my opinion, that would be the better thing to do. And then go get a consultation, and get more than one if you're able to. My insurance did not cover it, and insurance will cover eyelid surgery if after all of the pictures are taken and the measurements are done and your eyelid or the fat content on the top is pushing down so far that it obstructs your view by a certain percentage. I didn't have that. I felt like I had that in one eye, but it didn't. My insurance did not cover anything. And the procedure was very expensive. 2 years ago, it was $7,000. That's a lot. Part of that is because it was in California. It's expensive at UCLA. In Seattle, it was $4,500. You can get it cheaper. I wanted it to be in a hospital, and I wanted it to be with a board certified plastic surgeon, not dermatologist or not somebody in a clinic. And so, you know, I made, I think it was 3 or 4 payments, can't remember, but I was able to do payments. I was working as an RN full-time at that time, and when I would get a paycheck, I would call and give another payment until it was completely paid for before I could actually have the surgery done. They will book it, but they won't do it unless you're you fully paid for everything. I hope this was helpful. If you have any questions, please let me know. And I hope that you enjoyed this. If you did enjoy this and it was helpful, please click like, because other people won't see it unless there's some interaction. And then the way the algorithm goes, it will take off a little bit more if other people can interact or like. Have a wonderful day.